Health emergencies, such as the one that we're experiencing, usually result in an increase in violence incidents, particularly among vulnerable groups of women, girls, and children. The increase in violence cases, predominantly gender-based ones, has been witnessed globally, and Kenya has not been spared either. The country has witnessed a 7% increase in the number of all forms of violence incidents from March to June compared to a similar period last year. We have noted with concern that some counties, particularly Wajir, Turkana, Kisii, Nandi, Lamu, Homa Bay, and Kisumu, have recorded a 30% increase in cases of violence since the beginning of the pandemic. Worse still, and this really is a shocking statistic, close to 5,000 rape survivors have received medical treatment in health facilities during this period of the pandemic. Children below 18 years bear the greatest burden, as they comprise of 70% of these survivors, with 5% of these survivors being male. Ladies and gentlemen, some people say the measures that we have put in place for the purposes of curtailing the spread of coronavirus disease may have contributed to the aggravation of this violence. And it is important that we point out that these measures do not at all justify any violence being meted out on innocent members of our society, more so women and children. Measures such as movement restrictions, which have been in place and have since been lifted, the disruption of social networks, the loss of income, were all meant to address the COVID-19 pandemic and not intended to trigger or indeed become an excuse for any form of violence. Unemployment, the inability to provide for families, the economic uncertainty that we are facing may have added extra strain and heightened anxieties amongst families. However, again, we do repeat that this is not an excuse to meet any form of violence.